Our next speaker that we're going to welcome up, it's important in any industry to have a bit of a contrarian. And for that reason, I'm really stoked. So Ben Greenberg is somebody that I met a few years back. I hosted a small summit up at the Aspen Institute, I still do, called the Aspen Software Leadership Summit. I host 30 people for a private off-the-record event so we could hear all of the insights into what life is really like inside companies like Tesla, Uber, Netflix, and WebMD. And we were thrilled to have Ben Greenberg join us up in Aspen then, and I'm equally as excited to bring it up now. So Ben, would you come on up here, please? So Ben is the Vice President of Product and Design and Innovation at WebMD. How many of us have used WebMD, right? Probably the #1 medical content site in the world. And to tell us a little bit more about that, and artificial irrelevance, Mr. Ben Greenberg. Ben, take it away. Thank you. Great to see you.
Thank you so much for having me. Great to be here. Let me start by telling you that I live in Brooklyn with my wife, and we have a daughter who is 15, and we love her more than anything with every fiber of our being, though we concede that this is probably a trick by evolution to keep us from eating her and then and abandoning her as she becomes an adolescent and really, really obnoxious. And what I will tell you is that to her, we are the most annoying people on the planet. There is nothing that we can say or do that doesn't humiliate her. So it was no huge shock to me when the other day she came to me and said, "Dad, my friends are coming over in like 5 minutes, so can you not do that thing?" And we were like, "Okay, what thing?" And she's like, "That thing where you're like, 'Hi, how are you guys?'" And I was like, okay, so no face-to-face communication or empathy of any kind. That's too embarrassing. And my wife got really upset. And we said, well, look, maybe we're the worst parents in the world, or maybe she'll grow out of it. But I can't help but think that it is not helping that she is completely addicted to Snapchat and Instagram, and she spends 12 hours a day on this stuff, and I'm worried about her, I'm worried about their whole generation, because they are part of the first generation that is just relentlessly curating their self-image to harvest likes and the dopamine hit associated with favorites, and the long-term health consequences of this are just not clear. And when you couple it with a teen female suicide rate that has doubled in the last 10 years, you start to really understand what a tremendous responsibility it is to be developing user experiences in 2018. It's about real people's lives. And I think for the people in this room, if we don't consider why we're building what we're building, for better or for worse, we're unlikely to create a product which inadvertently rips apart the social fabric of the planet the way some of these social media companies may have done. But what will happen to us is that we will people aren't going to use our software because it's going to be tech for tech's sake, and it is not going to fulfill real need states. So this is something I want to talk to you to help you avoid falling down the rabbit hole of buzzword-driven development. Voice and AI are very big buzzwords right now. They're incredible technologies, but I just want to sort of try to inject a little bit of sanity into when you're thinking about using these technologies. So fortunately, the people who are creating AI research right now really are thinking hard about the ethics and morality behind it. As an example, consider the self-driving car. Now, if you are driving a car at the top of a cliff, and let's say that all of a sudden, the most beautiful family in the world appears before your eyes, of all religions standing together right there before you, there is nothing that you can do. Your car you're going to drive into them, and it's going to be horrible. But there is nothing that you can do to make yourself drive off of the cliff in order to save this family. Your body just won't let you do that. However, if we're developing self-driving car technology, do we not have a moral obligation to make sure that the car saves the family and drives you off the cliff to sort of save the most people? And it turns out nobody wants to buy a car like that. So it's a very complex situation. You have to think about all these things, and so a group at MIT has created this crowdsourced methodology for going in and logging in and saying, okay, what should a self-driving car do in each of these situations, and who should it sacrifice? And maybe I'm a sociopath, but it gets really depressing to me once you start putting little puppies in there. And I have a colleague at Uber who is in charge of the UX for their self-driving car program, and she says, well, this is called the trolley problem in ethics, and she says, this is a fallacy. We're never going to have to worry about the trolley problem, because what we're going to do is we're going to create the greatest brakes in the world so that the car will always brake before hitting anybody. And I said, well, okay, if you do that, though, what if the Queen of England is behind you on a motorcycle? She's going to slam into you. So you still have to think about these judgments at some point. So I think everybody here has this feeling that we're sort of teetering on the precipice of this true AI revolution, which is just going to change everything about what happens. Although we've been on this precipice for a little while, and we're sort of waiting for self-driving cars and waiting for all this incredible technology to hit. So since I'm going to go and tell you that it's a little bit of a buzzword, and since I'm going to warn you about this stuff, first I want to say outrightly, I do feel like AI will change the whole planet. I think it will be unrecognizable in 50 years. I think that will eventually happen. As an example, Ray Kurzweil from Google says that in the 2030s, we'll have nanobots in our blood that make us superhuman. Now, this is such an abstract concept. It's hard to get your head around, but I'm talking about nanobots that, as an example, let's say you have a heart attack. You're going to call your doctor and say, doctor, I'm having a heart attack, and she'll say, well, try to come in within the next month, because you'll have so much oxygen going through your blood from these nanobots, which can carry so many millions of times the amount of oxygen as hemoglobin. So we're talking about stuff that really will change the planet eventually. But I want to look at the state of where it is right now. And again, eventually, AI has incredible medical potential to do all of these amazing, helpful things. But if you look at the media and you look at the way that AI is currently positioned, it is positioned as an extremely confrontational technology to physicians. Here are some headlines that we see every day. Robot doctors will absolutely replace surgeons. Prepare yourselves, robots will soon replace doctors in healthcare. AI versus MD. So there's this real confrontational setup being planned, and you can hardly blame the media. It's such a juicy series of headlines. You get so many clicks, but we decided, there's something really crazy when you see this amount of hype about something. So we decided to really delve in and get closer to it. Now, here's another example. Andrew Ng, one of the fathers of deep learning at Baidu and later Google, posted this really interesting question. He's saying he's getting an email from this physician here in the, oops. Sorry, I thought it was a laser there. In the middle box there. He is getting this email from a physician saying, or a medical school student saying, hey, Andrew, I'm 3 years into specialist radiology training. Should I quit? Because the thought is AI is so close to replacing radiologists that maybe I should just quit medical school. So there really is being looked at as a severely confrontational technology. So we said, this is hype, and it could be deserved eventually, but let's go in and look at how physicians really feel, practicing physicians. So what we did was we surveyed about 1,500 of our members, 500 in the US, 500 in EU, and 500 in Latin America, to see what people really thought. Now, only 33% felt that their role could be threatened or undermined in the future by AI-powered software. So that's not as low as I would like, but it really is not at the level of, terror that you would think from looking at the media. Interestingly, only 15% say that to date, AI has changed the way they practice medicine, which is really interesting. And if you want to split hairs enough, you could say that anybody who's Googled something has actually been affected by AI, because there's AI in back of what Google does. But this shows you about the mentality of a physician. They're certainly not yet affected by this AI revolution. And Though 68% do say that within the next 10 years, they'll expect AI to have a positive or very positive impact on how they practice medicine. So they're looking ahead to that. And this, if you know anything about physicians, really gives you an interesting insight into their psychology. 58% said that AI-powered software will never be better than human beings at diagnostic tasks. And the word never, I mean, time is a very, very long x-axis, so the word never is probably problematic. This is how we like to think of it. Artificial intelligence will not replace radiologists. However, radiologists who use AI will replace those that don't. A great quote from Dr. Mesko. If you think about the invention of calculators, calculators did not eliminate the need for mathematicians, just freed them up to be able to concentrate on higher level tasks. So since we're here at Voice, let's talk about what this means for us as people looking at the voice development industry. So like you, I get a lot of email from vendors. And I saw one in particular that I'll share anonymously. And it sort of said, hey, discover how pharmaceutical brands are using Alexa to reinvent customer experiences. And there was a real kind of hysteria to the vibe of the email. It was very like, hey, you guys gotta get in on this. You've gotta get an Alexa skill. And it really reminded me of this dude. In 2018, brands will have to reimagine the experiences they can offer physicians, and fast. And every time I see this, and fast, I just get really skeptical. Otherwise, they'll stand no chance of having a meaningful role in the world of the fully realized Internet of Things. So to me, when you start as an industry telling people that they need to develop Alexa skills right away and really pushing this, I think it's a really dangerous thing to do, because obviously we all love Alexa, we love Google Home, but if you have a company create an Alexa skill without really fulfilling a need state and identifying how it's going to be discovered, you are setting your clients up for a real scale problem where it can easily sit in the skill store and just sort of never get invoked. And there's a real parallel to that to apps 10 years ago. You either know someone or you yourself spent millions of dollars creating an app because it was the hottest buzzword, only to have it sort of sit in the app store and not get the true downloads at scale that you had expected to get. And to understand why this is, I want to look at the native workflow of people who actually depend on software. So since we're not all physicians, I like to use online shopping as an example, right? Let's say you need to buy an iPhone case, you need to buy a book, you need to buy Pampers, you need to buy toothpaste, you need to buy cat food. Of course, you're going to go and download a Radio Shack app, and then you're going to download the Barnes & Noble app, and then you're going to download the Pampers app, and then you're going to get each one from each. Nobody in the world would ever do this, right? Of course, you would never go download all these apps. What would you do? You would probably just buy it all on Amazon, right, where you can get everything. It's the same thing with Alexa skills. I really reject the idea that, especially in the pharmaceutical industry, especially with physicians, that a physician is going to start saying, hey, Alexa, tell me, ask pharma company A, what is the dosage of, warfarin? It's not going to work that way. At most, we'll be lucky if physicians end up saying, hey, Alexa, what's the dosage of warfarin, without invoking any of these brands. So the idea that you're trying to build skills for each of these pharmaceutical brands is just neglecting the way people really use them. And I think it's really important to realize that before you just go spending a lot of money in this gold rush of creating skills. Skills are incredible, but you gotta really have a real reason for building one. Same thing is true, as I was saying, in pharma. If a physician wants drug monograph information and they want mechanism of action video and interaction data and then pregnancy and lactation video, they're not going to go to 5 different pharma apps. They're going to go to Medscape or even one of our competitors, but the point is they will go somewhere where they can get all of this stuff at once. And like I said, the same thing is true for Alexa. I will say, Alexa, what's the dosage of warfarin? Not Alexa, ask pharma company A what the dosage of warfarin is. So there is a reason that voice is used as the dominant modality in science fiction, right? I really do believe voice is incredible and that one day our grandkids will probably make fun of us for ever having used a keyboard. I really do feel voice is an amazing input modality because it has some very real benefits, right? And let's look at those benefits quickly. Voice input is extremely fast. Humans can speak 140 words per minute versus type 45. It's very easy, it's convenient and hands-free. And you get random access versus hierarchical navigation, which is just a nerdy way of saying that it's much easier for me to take out my phone and say, or just to say to a room, hey Alexa, what time does Chuck E. Cheese close? Versus go to my phone, unlock the device, go to Google, Google the Chuck E. Cheese, look at the times, make sure it's the right one. And all these steps add to the interface friction of the task. And that may sound like the definition of a first world problem to you. Like, hey, this guy can't even take out his phone and just look something up. But shaving off that kind of friction is precisely what leads to these interface innovations, which end up really transforming modalities and creating new ways of computing. So even though we're at voice, let's say on the down low that speech is a terribly inefficient output modality for most kinds of information. It's great if you need a quick answer, like, hey, is it raining? Yes, it's raining. Yes, it's going to rain. It's great for that. It's great for very linear, long-form sets of information, like a podcast or an audiobook, and you can sit and listen to it linearly. It's great. It really is not great for information that's structured that people need to satisfy. People don't read web pages, they scan them and look for the components that they want, and they want to do that themselves. That's why on so many Alexa skills, when Alexa ends up reading something back to you or reading options back to you, that's why people get very, very frustrated by sitting there and listening to these long-winded kind of things, and there's no way to skip and there's no way to get back, and so that's why it causes all this frustration. There's a reason that Captain Kirk would say, computer, show me a map of all the Romulans in Sector 7 versus, hey, Captain Kirk, hey, computer, tell me the location of every single Romulan so I can put it into my brain and form a mental model and then try to keep all that crap in my head. That's just not the way people do things. So you need this visual component to parse most kinds of output data. And of course you can say, hey, Amazon has the show, great product, and you've got all these other modalities coming out, all the other products coming out with screens, but they don't have the same scale as an Echo Dot, for example, has. So let's look at physicians and whether they are currently using voice-controlled smart speakers such as Alexa. So when we ask, do you use a voice-controlled smart speaker at home, and the US is in the middle here, you can see that a huge amount of physicians, compared to the rest of the world, do use an Alexa or Google Home device at home. And you can see in the middle there that Amazon Alexa is way more popular in the US than it is outside of the US, which is, I think, why, and it could be because of marketing differences. It took longer to start marketing out to Europe and other locations. But it is interesting to note that Google Home is really the product of choice outside of the US. And it's interesting, there's still a large percentage of people saying no. But it really gets mind-boggling. And think about this when you go and you see all of these different skills being created for physicians and medical skills. These physicians are at scale not using smart speakers at work for professional purposes. And if you think about it, it's not that hard to imagine why. I mean, first of all, what are they going to do? Like set a timer or play Spotify or like control lights. So you got to think about this on planet Earth right now. There are not that many things for a physician to do with these smart speakers in their office. There are other reasons. And by the way, if they did, here's what they would do. Not a lot of these exist right now. The ability to look up drug information, check for drug interactions, and adding notes to a patient EMR is a really interesting one, even though the number's lower, because it really would satisfy a true physician need. And physicians are at scale miserable with their EMRs, and it takes a ton out of the patient-physician relationship. So it would be great to get a skill that did that. Now, if we go and you know, at Medscape and WebMD, we're thinking all the time, hey, should we create a physician skill that allows, you know, a physician to access clinical decision support at the point of care? Well, when we're surveying these folks, almost 50% are saying yes, they would use something created by, you know, us, for example, or even the government, even a technology company. But it's also interesting to note that when it comes to pharma, physicians really don't want to see a clinical decision support skill from pharma, and for these reasons. I mean, they're concerned about bias and you know, and these other factors. So another interesting component is this: if you think about how you are going to start monetizing Alexa skills, because at the end of the day, we're in this greenfield gold rush that reminds me a lot of the app explosion. There's a lot of really cool stuff, but in the end, you're gonna have to create value and money and meaning in order to have this stuff stick around and become, you know, what we know it can become, or what it needs to become. Right now, as you know, advertising is pretty much prohibited on the Alexa platform. You can, you know, use an ad if you are a podcast, if you're music, your radio, for example, and there may be a few other exceptions. And I think it's a good idea that Amazon is doing that, because there's a very low amount of tolerance for the kinds of ads that otherwise might occur. So, for example, if a physician were to say, hey, Alexa, does drug A interact with drug B? You wouldn't want to hear back, yes, drug A interacts with drug B, brought to you by pharma company A. There just isn't really a lot of tolerance for that kind of tacked-on advertising. So it does remind me of the Apple Watch. And when we created at WebMD this, worked with Apple to create this medication reminder for the Apple Watch. It was a really cool use case. But we did have stakeholders saying, well, how can you ever integrate ads with this? Are you ever going to have like little teeny tiny ads at the bottom of an Apple Watch? And it's like, no, that's not really what users want. It's not going to make sense to do that. So what do? It's a multimodal ecosystem solution. So you think about, yes, we can't show a tiny little ad at the bottom of this Apple Watch, but we can see how a user behaves with this system on the Apple Watch. We can know more about what their desires are. And then when they come to our site later on, when they come to our app later on, we can target them better with messaging that either is going to help them out and at the same time monetize. And so you can't look at these things. I don't think anybody should be looking at Alexa as, you know, right now, how are you going to monetize on that specific modality? Maybe the thing to do is collect information on a user and you know, obviously doing the right thing privacy-wise, that's the utmost importance. Otherwise, you're going to lose the user if you know, trust isn't the framework of this. But in ways that actually help the user, if you can allow them to use the Alexa as one particular modality and then integrate the rest of your promotional messaging or other features on your other systems. So I will leave you with this long tail representation, because I think there may be developers here who go through a similar problem, and if there's one sort of real kind of low-level cool trick that we used as part of the WebMD skill, which I think is really important, you're going to run into, if you're delivering content via Alexa and or via Siri, via any of these voice interfaces, you are going to run into this problem pretty quickly, which is that it's a long tail issue. So if I ask Alexa, hey, how do I treat a headache? How do I treat, any of these real popular things? It will work. But if you end up asking an obscure question, and there are so many obscure questions in the long tail, you're just never going to be able to handle all that data because it's too vast. So we realized quickly that at WebMD, we had all these answers. They were just located on our website. And so it wasn't digestible information that that Alexa would want to read back. No one's going to want to sit there while Alexa reads you a big web page when you've asked a specific question. So what we're doing instead is having machine learning algorithms go through our website, digest all this content, and then create a series of granular questions and answers. So if you think about like Mary Had a Little Lamb, for example, from Mary Had a Little Lamb, you can get like 50 questions. Like, what color was the fleece? White as snow. All these different questions from that. So if you have machine learning algorithms that can go digest your content and then go and create these granular question and answer sets, you're not going to have to do the same level of investment in having humans go and fill out this database of, an infinite, close to infinite set of, possible answers. So I don't know if there's Q&A. If you want to connect, I would love to connect with you on LinkedIn or Twitter and continue the conversation. And thank you so much for having me.
Let's give it up.
Thank you, guys.
Thank you, Ben.